Good afternoon. My name is Nikkhah, and I will talk a little bit about upper lid blepharoplasty. This is a cosmetic procedure that can be done under local anesthetic or local sedation. That is a procedure that I routinely do in minor theaters. And I'll just talk about the process mainly to help patients and surgeons understand how we do it. So this patient's kindly shared her pictures with us. Um, she presented to my clinic with heaviness of her eyelids, excess skin, and usually you can get a good picture of whether an upper lid blepharoplasty can help. The incision is usually 7 millimeters above the lash line, and um, you mark like a lenticular incision. What I usually do is do the markings with the patient sitting, standing, um, and then I measure with these calipers as well, do a pinch test. You know that you've got enough tissue out when the lashes turn somewhat. I learned that tip from a famous facial aesthetic plastic surgeon, Niall Kirkpatrick. Um, and then you look and make sure that you've got the similar markings on both sides. On the medial side, you shouldn't go beyond the medial canthus, as that can cause issues with webbing. Laterally, I go a little bit further and take a little bit of tissue. I routinely don't have to take slither of orbicularis. Um, you can, if there is a medial fullness, take the fat pad medially. So this is the markings. And then I infiltrate the area. I use dental local anesthetic. Um, in terms of um, removal, I always photograph what I've removed. Um, and then in terms of the surgery, I always use a blade. Some people use a fine tip monopolar, but I find the blade is very good. Other tips, wait at least 20 to 30 minutes after you've put the local anesthetic in. When you put the local anesthetic, you can almost hydrodissect that plane that you're going in. Another tip, once you've done the excision, is how you kind of place the steri-strips. I often use 6-0 nylon, correction, 6-0 Prolene underneath the skin, um, and use a subcuticular stitch. If there's any slight openings or gapping or anything like that, you can put a few interrupted 6-0s there as well. So that gives a nice kind of cosmetic result. I always put the steri strips on the nose and laterally. I used to put steri strips over the suture line, but actually that can be quite troublesome for the patient. So I just put chloramphenicol there. I advise patients to, in the recovery, to have an ice pack. At home, they can use something like a bag of ice peas, and that conforms quite nice to the orbital space, and that can reduce problems with swelling and edema. So this is an early result. So this is the patient at 1 week. You can see that the patients had a pretty good result. They've got brown tape over the steri strips, and this is their result at 3 months. So it can have dramatic outcome, particularly in patients that have got some hooding and issues with regards to excess skin, um, and it can rejuvenate the eyelid complex. The operation usually takes about 90 minutes to 2 hours, and most patients can tolerate this under local anesthetic. I've had some patients who've requested sedation, but I think it's usually not necessary. This is another patient. You can see some asymmetry in her eyelids, and actually the upper lid blepharoplasty has created symmetry. So that's a nice kind of summary. Usually these patients I follow up for up to 3 months and discharge. If there's more complicated cases in terms of upper lid blepharoplasty, I usually involve my oculoplastic colleagues, but this is a operation that is quite rewarding, and it's something that, as a plastic surgeon, we do quite routinely. Thank you very much.